I'm running slightly behind today for our live session. It's I think 3 minutes after, but I really want to talk about 3 main supplements that I use for people who are experiencing problems with food cravings. And generally it's sugar cravings, but the 3 top supplements I use for food addictions or food cravings. So I'm Dr. Natalie Gonzalez. I practice in Synergy Health and Wellness. That's my business. And I am an integrative and functional medicine practitioner. I am a retired surgeon who went back to train specifically for integrative and functional medicine. Integrative just means that I use complementary or alternative types of things along with conventional medicine treatment to optimize somebody's health. And functional means that I look for the root cause. So I want to know the underlying cause of your symptoms and treat it at that point rather than putting a Band-Aid on something. Today I'm going to go over a little bit more information about what I talked about previously in terms of food addictions and food cravings. Again, it is not something that you necessarily have a lot of control over because sometimes genetically we just get much more dopamine surge when we eat certain things, and certain of us genetically are more prone to those kinds of addictions than somebody else might be because of our genes and our brain chemistry. And it takes some rewiring or retraining of the brain to actually affect that long term. But in the meantime, I do use 3 different supplements for food cravings. One of the first one is one that has a funny name. It's called Gymneva sylvester. It's an interesting name. It's used primarily for people who have sugar cravings, and it's very similar to some other medications that we use in medicine, but this is a supplement. You can get it over the counter. You have to be a little bit cautious of it if you are on insulin, because it can make you have lower blood sugars. But in general, it's also used, it can be similar to the Ozempic because it can give you kind of just a little bit of some indigestion or sometimes diarrhea. So it can cause some stomach discomfort. But what it really does is it keeps you from wanting to have sugar and things that are high in sugar. And so it can be really helpful that way. The next one that we use, which I find very effective for a lot of cravings, not just sugar, but like alcohol cravings and just cravings in general. It's also good for people who have obsessive compulsive syndrome because their brain chemistry is wired that way. But it's called NAC. NAC is N-acetylcysteine, and it's usually taken about twice a day. Usually it ends up being around 600 milligrams twice a day to be really effective. And it just kind of takes off the edge so that, maybe if it's alcohol, you will drink the alcohol, but it just won't taste the same. It just doesn't really set really well with you. It just lowers that craving, and it's not immediate. It has to be taken over several weeks before you notice that kind of effect. It's kind of subtle. But it does work quite well, and it works on the same principle as something like naloxone or naltrexone, which we also use for alcohol dependency. And then the last one is citicoline or D-choline. Citicoline is another one that we use for anyone who's dealing with drug dependencies and cravings, but it also works for food addictions and cravings too. So those are the 3. I know they can all be obtained as a supplement. It's really good to work with your doctor or your healthcare practitioner if you're interested in using those things, particularly if you are a pre-diabetic or a diabetic person and you're trying to work with these things a little bit. And especially if you're having problems with alcohol dependency and addiction, that it's really good to, if these are not working, especially if NAC doesn't work, to consider the naltrexone or the naloxone. And some of those can be obtained over the counter now. So, that's really nice for people who are struggling with that. And just keep remembering and reminding yourself that it is not necessarily something that you're doing wrong. This is a genetic in many, many cases. It's a genetic dependency, and it's a brain rewiring and a brain chemistry problem. So that if you can get some help with it, not just these supplements that I'm talking about, but if you can get some help there are medications that we're using now that are much more effective for helping you manage these things. And then, from the standpoint of functional medicine and integrative medicine, like I said in my previous video, it's really helpful to substitute things for those foods or medications and chemicals that our brain gets kind of addicted to, because we get such a nice dopamine surge, and dopamine is kind of a reward chemical that our body gets very addicted to rather. And so it's really helpful to be working with somebody who has some experience with that if you need it. So I just think there are some really good medications out there that we didn't have in the past that are helping to recognize that these are genetic tendencies, and they are very much brain chemistry imbalances, and we have some really good medications for that too. So I'm Dr. Natalie Gonzalez. If you think this is helpful for you, send it to somebody else that it might be helpful for. And if you think that you don't know anybody like that, then have YouTube do that. Just like the video so that they can send it to somebody. And we will be making more videos like this. So especially live ones, till I really get good at this and I really am able to film something in a more concise way that's really helpful to people. I'm going to give you my best here. So take care, go out and have a great day, and we'll see you in the next video.